So what happens when there is some sort of triggering event that then throws people into a full on, it sounds like it's not truly like an infectious state where they're running a high fever, etc. It sounds like more it's just this hyper inflamed state. Is that correct? Or is it more of the classic presentation of an infection?
So it's not a classic presentation. Once you've had it and it's disseminated and you now have like these chronic tick-borne infections, really what happens is it's a cycle between like the immune dysregulation causing the inflammatory cytokines worsening the immune dysregulation. And what happens is it ends up making the body hospitable to these infections. So the body and what is created inside of the body not only allows these organisms to survive and evade the immune system, but it actually helps them to thrive. And this really comes down to the inflammatory cytokine cascade kicked off by nuclear factor kappa beta. So nuclear factor kappa beta ignites IL-6, IL-1 beta, tumor necrosis factor alpha, the MMPs, which are like the collagenases that break down collagen and feed the organism. And so a lot of this is also going to go into like why patients with tick-borne disease end up with such bad gut dysfunction. So this inflammation, it happens at every single cell in the body. And I think a lot of people don't realize that Lyme infects every single cell of the body. And so you're going to have dysfunction in all of your organs and your organ systems. And it's going to lead to what can look like, multi-system failure in the body. Mm-hmm. And so anyways, back to the gut, you're going to end up with breaking down of the tight junctions, which increases permeability. And now you're leaking toxins back in, you're letting in, undigested food or partially digested food, polypeptides in. Now you're going to create a bunch of food sensitivities. You're going to have histamine levels go up. And it's just this vicious cycle. So when I'm working with a patient, I always say, there is no one size fits all treatment protocol, because I now have to figure out what is going on inside of you as an individual. Like, how have these infections played on your genetic and physical weaknesses that have now made you have like this puzzle that we have to go in and figure out what all the pieces are. And then if we can figure out what the pieces are, we can help to make you inhospitable to the infection. We can lower the cytokine cascade. We can try to rebuild and balance the immune system while we're shrinking the infectious load, because in the end, it's our immune system that always has to either completely eradicate an infection or get it to the point where it's not replicating like into like sort of a remission. So we can use herbal or prescription antibiotics, but if we're only using antibiotics, not only are we going to mess up the microbiome, and our immune system is dependent on our microbiome, but if we only focus on killing the infection, you're never going to have a chance of eradicating it because you're not fixing the immune system.